Welcome to Knowledge on the Go, the podcast brought to you by the Performance Improvement Programs team at Vizient. In healthcare, every decision affects a patient, so performance improvement is essential. Through shared learning, benchmarking, and hands-on collaboration, we focus on driving measurable results and better patient outcomes. Joining us today to discuss her performance improvement work is Dr. Josee Gill, Director of Quality for the Bellin Region at Emplify Health. I'm Shannon Hale, Senior PI Program Director at Vizient, and your host. Dr. Gill, welcome to the podcast.
Thank you, Shannon, and thank you for inviting me, and you can call me Josie.
Josie, you and I, we share a similar role in performance improvement. How did you find yourself in this work? What was your journey to this point?
I started off back in Canada. I needed to do 4 years of med-surg. My goal was to be an ER nurse. So I've worked in the emergency room. My goal was, how can we improve care to our patients? How can we make it better and safer for them? I always expected the patient to be a family member of mine, and I wanted the best of the best for all of our patients. My journey went through emergency room and emergency department, and eventually I became director. I really looked at how can we make improvements with our team, providers, ER nurses, CNAs, EMTs, improve the care with project improvements and performance improvements, looking at sepsis and stroke and the response that we're giving, working with the staff to see what the barriers are, how can we make improvement. Many, many years later, I went into quality. It was one of our sister facilities because I was in Las Vegas at the time as an ER director. Focus with all of the teams and the leadership on how can we make Henderson Hospital number one and why patients would want to come to our hospitals versus going to another facility. We really embraced it, and I empowered staff to speak up.
Hearing you say that you talk about your journey, we actually have more in common than I even knew. My background is emergency room, and that piece about viewing every patient as a potential family member rings true to me. That's actually what drove me into healthcare. And it's very true. We need to see every patient like they're a family member. We probably see different treatment if we all look at it that way. You're with the Bellin Region at Emplify Health. If anybody's joining us today and not familiar with your organization, could you tell us a little bit about Bellin Region at Emplify Health?
We have a large medical center in La Crosse, and we have a complex care medical center in Green Bay. We have 7 critical care access, and we have hospitals in Iowa, Minnesota, Wisconsin, and we have 2 nursing homes, and they're both in Minnesota and Wisconsin. And we also have Michigan hospitals with our critical care access.
At the heart of all we do, whether we're members, whether we're Vizient staff, is improving care and delivery of that care for patients. You've taken part in several of our collaboratives. How has that participation helped improve care for patients at Emplify?
The presentations that we have listened to were very interesting. I love how we can share with other facilities and how other facilities share what they're doing. Sometimes you say, oh, we're doing really well in sepsis. We don't need a collaborative. But at the same time, you need to sustain. And how do you sustain? And the collaboratives were very informational for us. I love the sharing from the other hospitals and the connections. And I've also presented with another hospital on sepsis at one of the Vizient conferences. And it was interesting to see that we're not so different. We're all the same. We're all learning, and we all have this journey. It's the support that we get that says, we are doing the right thing, or maybe there's something that we want to change and we can add in our system, or we can even improve care for our patients. That learning has been really beneficial. We did participate in sepsis, and we're participating in the mortality ones, the emergency room access. We've joined the pharmacy one. And really, the length of stay experience, our finance team is also participating in the finance section, and also the supply chain team is participating in some of their collaboratives. It's a place where we can see benchmark, we can see who's doing well, we can reach out to those hospitals, and we can make improvements in our data.
I love it. You're doing a lot of performance improvement work. You hit on 2 key things. Sustaining improvements is always a struggle. And then also the piece about always improving. You mentioned we're doing great in sepsis, but there's always room to improve. And it sounds like you're really taking advantage of that and really seeing it through that lens. That's got to be great.
I always believe 99% is not an achievement. When my son was in high school, it was very easy for him. And he didn't even study, and he always had 99, 97%. And I always said, 99% is not an achievement. You can do better and do more exams, more tests, more questions, more homework. He ended up with 114% in math. He asked me if I was satisfied, and I told him I was getting there. As a quality leader, I am never satisfied with just being at 99%. If we're at 80%, which is great for sepsis, we need to be higher up than that. What else can we do? What are other ideas?
If a patient was listening to this podcast now, they would be assured that someone with that mindset is the director of quality. 99% is not good enough. So we continue to look to improve that care. I love it.
I did not traumatize my kid. He became a teacher and he pushed his students to do more. If we failed, if we didn't do something wrong, let's learn from it. Let's see how can we be better. And really not go with the punishing or you did something bad. It's explaining what are we looking for, what is going on, and what do we need to do, but really not the blaming part. So I've never blamed my son for his 97%. When he became a teacher, he pushed his students to do a little bit more because everybody can learn and continue to learn and grow.
And that's what we're all here to do for our patients and their families. I talk to people often that are new to either performance improvement or quality in healthcare, or maybe they're just looking for some insights. You have experience in this. What advice would you give those folks as they begin their journey? Any advice you would share?
My first biggest advice would be to understand the work. Spend time with the frontline staff, with the physicians, with the clinicians, with the nurses. Listen to their challenges. Observe the workflows firsthand. Go there and observe it. And at the same time, you're building that relationship with those leaders and you're building that trust. Data is always critical. I always say you need to have data, but data is only good and it's only part of the story. The other part of the story is the relationship building that we're doing, the listening to the people, and really looking at what actions are we going to put in place to make changes. Never blame and never say you did this bad or this is what your score is. Sustainability is so hard and so difficult. And you may do very, very well at the beginning and everybody is cheering and we've got improvements, but then you've got other projects coming into this team and then it might get lost. Build that relationship with people. Listen to their challenges. See if there's anything you can remove from it, but also don't blame. Make sure that you're continuing to check the data. Get senior leadership or executive leaders involved, focusing on the organizational goals of the hospital. And if you have that, then you're going to be able to make changes.
Those are some great tips. I love the piece about speaking to those that are doing the work. We actually found that out with a recent project. If there's a new policy or procedure or a new feature in the EHR and it's not working well, a lot of organizations are finding by doing rounds, going out there and speaking to those that are doing the work and asking, well, what's the barrier to documenting XYZ? They're getting great insights into what those barriers are. I love that piece about speaking to the front line. You mentioned getting the buy-in for various improvement projects. Is there anything that you found helpful?
You need to learn how to speak to leadership in their language. What are the goals that we have as an organization and what are we working on? Showing the data. Where are we at? One of the things I really like from our Vizient collaboratives is that we find benchmarks and we see where we are. Are we in the benchmark top or are we really low and we've got to make improvements? The buy-in goes into the why. Why are we doing this? Is it really focus on patients? Is it really focus on the work that needs to make improvement? We really want to focus on how we're going to engage. Senior leadership or the executive leadership is going to help us engage the staff.
And I bet even if you're in the top, that's not good enough for you, right, Josie?
No, it's not. I have very high standards for everyone.
And patients can take pride in that. You mentioned sustaining improvements. We talked about this in a recent podcast that's come up, and it's a frequent struggle we all deal with. Anything that's working in your organization around sustaining improvements that you had mentioned?
For us here at Bellin and with Emplify, because we've also implemented this in our Gunderson region and also in our critical care access hospital, is focusing on when you start a project, who is going to own the sustainment? We really need to have the emergency room, the ICU, or the different departments, medical or other departments, to own the project that we're going to be working on. For example, if we're working on a pharmacy project, we need to have the leadership involved. Sustainability starts on day one. How are we going to attain? What is our goal? What are the incremental measures? Because you're not going to go from 0 to 100 right away or 114. You want to go from little increments. So how can we make improvements? Talking about the ownership. Performing audits after. Once we are done and we've celebrated, you got to celebrate those success, even if they're small. And if they're big, you're going to celebrate even bigger. But you want to celebrate at multiple different times of the project. And after the project is done, and you say, okay, we're done. The project is sustained. It's been 3 months now where everyone knows, everyone understands. You're still going to have some changes in the staffing. You're going to have new nurses arrive, new clinicians arrive. We want them trained on the new process as well, or on the process that we are doing. We do audits on a regular basis to see where we are. And if we see a drop, we get with the team, give them the data, find out why. It could have been because now we're working on a length of stay throughput and we need to get those patients out. And now the patients are moving from the emergency room to the medical floor. And we didn't train the medical nurses on sepsis and the components of the sepsis bundle. We need to identify those things. But that's how we sustain this, by starting out at the beginning saying, who is responsible for the sustainment and how do we get data, do the audits, and meet with the teams to say, you're doing a great job, or, okay, we have a problem here.
It's very similar to discharge begins upon admission. In quality performance improvement work, we're thinking of how are we going to sustain this improvement. They have that built in right at the beginning, and they hold folks accountable. We do have people that may be new to PI programs here at Vizient. So maybe they're looking at taking part of a collaborative or taking part in a benchmarking survey, or they're going to join a community call. Any advice you would give to someone that is just starting out in the Vizient performance improvement programs?
It's a great opportunity to learn about what the performance improvement project is, learn who's going to be on the teams, learn what other people are doing. Even though it may not be your priority work, you're still going to be learning from it. And you're going to build those relationships. Put that groundwork into your data, because that's what I've found a lot in the performance improvement work is structure and how you're sharing your work with others. So you'll have chartered improvement tools. You'll have your project submission. How are you doing on your project? I'm going to learn. I'm going to see what others are doing. We may not be able to attend the collaborative, but they're all recorded and we can go back, we can listen, and we can share with our teams.
Everybody listening to this will identify with the fact that we all have a lot on our plates. We all have a lot of priorities. And hearing another organization and how they handled length of stay or mortality or sepsis can be beneficial to me, because I'm sure those items are also priorities for my organization as well. Josie, I'm sure with you at the helm of quality, the future looks bright when it comes to performance improvement at the Bellin Region of Emplify Health. What does the future look like there for you when you think of performance improvement?
The future looks bright for us, even though there's many changes going on in CMS and in healthcare. So it's just making sure that we're continuing the work. I'm always afraid, and I've been in mergers in the past, and we've had our merger 3 years ago. And a lot of hospitals and mergers tend to decrease the care of the patient. And one of the things I'm really proud is that Emplify Health in all of our regions, we never decreased our care. We continue to make improvements. And we've communicated together very well. And we have a great improvement system. Do we have scorecards? Do we have team action boards where we can share the data with the team? Do we have leader rounding and the leaders going to the different departments and asking them about what projects are you working on? What are your barriers? What can I do to help you? The teams are seeing leadership engage into these team action boards and into these improvements. That's really has given us lots of structure. One of the things that I've enjoyed from day one since I started is that we have a lot of patient advisors. So once we do a performance improvement project, a length of stay, a sepsis, a mortality, an emergency throughput, we include patients advisors, and they are participating and understanding and giving us their views of how they felt when they were readmitted. For all of the leaders and the teams and the clinicians to hear a patient telling us how they felt, it makes us really go back to our mission and saying, how do I care with love? And how can I continue to make improvements with our patients? The future is very bright, and it's going to continue to be.
I'm assured it is based on what you just said. It's fantastic that you include the voice of the patient in your improvement work. One thing that you mentioned, we see a lot in today's landscape is mergers. Hospital systems becoming a different organization altogether by combining those items, the dashboards, the leader rounding, the engaged leadership. Would you say those are the keys that have kept your quality either at the level it was at pre-merger or even above where it was beginning?
I always believe in our management system. We are all focused on having our scoreboards, having our team action board, our tiered huddles, problem solving, performance improvement project, focusing on how can we make improvement. That has solidified and why we haven't seen a decrease in our care with the merger. And we've seen improvements in our care because we're sharing with our sister facilities and learning from them, and they're learning from us. So that has been really beneficial. I've not seen that all the time with mergers. I've had mergers in my past where we didn't see that work together, but it is great to see the collaboration that we have at Emplify Health.
I could speak with you all day. You have so many tips, whether I'm new to performance improvement or if I'm seasoned in healthcare performance improvement, some great advice and great tips. And I love your story and your involvement of getting that leadership engagement, including the voice of the patients, going to the front line and getting their feedback on new processes or tools. I thank you so much for joining us today.
Thank you. Thank you, Shannon, for this invite. And I enjoy speaking about quality and about patient care. So anytime, it will be a pleasure. Thank you.
Thank you, Josie, for joining us today and sharing your insights on your performance improvement journey. And thanks to you, our listeners. Please join us for more knowledge on the go. Subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com.